Hey, excuse the construction noise in the background. I'm going to go over the 2023 monthly premiums for the Medicare Supplemental Plan that is administered by Blue Cross Blue Shield of South Carolina, and the included outpatient drug coverage within the Medicare Supplemental Plan uh, is the administrator is Express Scripts. So you don't have to buy a standalone party drug plan, even though there are many plans in the individual market that are very affordable for $5.90 per month. But I'll tell you the not only the monthly premiums, but also when it's not competitive for you, the retiree or survivor, the retiree. So let's go with the lowest and most competitive premiums first and break that down. Then we'll go to partially funded, and then we'll go to non-funded. So fully funded retirees and their spouses. So this is for, as you can clearly see, you can go over the situations yourself in your household, but we're just going to go over the very top one here, the retiree that's eligible for Medicare and spouse eligible for Medicare. So the competitive rate here is $97.68 monthly. I can tell you from the past, these don't go up in terms of rate increases because um, since it's fully funded, they are very stable in nature. So it's $97.68 for the retiree who's eligible for Medicare. If you have a spouse and they're eligible for Medicare, it's $253.36. If you're a retiree and you have a child, please call SEPEBA, or if you have a full family, these rates right here, 143 and 86 and 306, those would be advantageous to you because obviously major medical is very expensive for not only children as well as a full family. Okay, we're going to go to the survivor monthly insurance premiums for funded survivors. It's the same price. So the survivor would be $97.68. Again, call SCPEBA to inquire if your children are qualified for these rates right here, as well as you, the spouse survivor, at $161.86, $64.18. Okay, I'm not going to go over the rest of these because you can go over those yourself, the different situations, spouse eligible, children not eligible. You can clearly see those rates are fairly good as well for funded status. We're going to go to next the monthly insurance premiums for partially funded retirees. So partially funded, you can clearly see it is a clear jump from $97 to now $329.22. That might give you a feeling in some type of way that you are obviously having to pay more. So $329.22. This is for you to be a part of the group Medicare supplemental plan. And so you are having to pay more because you do not qualify through your work credits and years of service. So if you are still in partial as a partially funded status with SCPEBA and you're still currently working for your state employer, or your credits or your job transfers to another state employer that is a part of SCPEBA, just note that you'll be paying more until you get that fully funded status. So if you're a retiree and spouse and you're both eligible for Medicare, again, your rate is going to jump $735.80. Again, call SCPEBA for these retiree and children and full family. When we go to partially funded again, you'll see for the survivor, it is a premium. The premium is a little bit less. For the supplemental plan, it's $231.56. So that's good. It's also competitive for spouse and children only. Again, call SCPEBA for these categories here for these situations. Okay, so let's end with the 2023 monthly insurance premiums for non-funded retirees and non-funded survivors. So you will clearly see that um, these funding, this funding status is above market value. You can clearly see that $560.78 as a secondary payer. Remember, you're only paying $164.90 for the current Part B premium for 2023 for Medicare, for original Medicare. If you've worked enough years and paid your FICA taxes, your Part A is premium free. Your Part B, for national coverage with over over 1 million providers that accept assignment and accept payment in full by Medicare, they're the ones that are only charging, the government is only charging you $164.90 currently for 2023. So as a secondary payer, the Medicare Supplemental Plan by PEBA, administered by Blue Cross, which is the healthcare side, with drug coverage is 500. With drug coverage with Express Scripts is $560.78. I know that's a little bit dramatic, but I just want to be clear that this is a very, very high premium when you're looking at a secondary payer. And I've had a number of callers and tried to help a number of people that found out that this rate keeps going up, and it has gone up for them. So even at the higher premium rate, every little bit counts, especially if you're living off a fixed income. Okay, so if you are a retiree and you're a spouse, you are paying $1,200 plus for your secondary insurance. So you're paying $164.90 each for Part B, and then you're paying $1,200. So that's so much money. So here's where you're able to, well, let's get through the non-funded survivors. Okay. So obviously you can see it's almost the same. Survivor 560, and then survivor with children, and if possible, if they're able to get on this supplemental plan. Okay, so let's go back. So as you can see, it went from $97.68 fully funded to partially funded is going to be $329.22 to non-funded $560 and 78 cents. You can clearly see that you are paying a huge amount when you're going from funded to all the way to non-funded. There's a huge difference there, and so that's where an independent broker like myself, it doesn't have to be me, but I would love to be able to give you this information and help service you, because I've helped so many folks that are retiring from the state of South Carolina into the individual marketplace for Medicare insurance, which means that you have two different options. You have the option to obviously stay with SCPEBA and enroll in the Medicare supplemental plan, or you can look towards the Medicare supplements that are available to you. Those are letter plans G and plan N. Plan G doesn't have copays. Plan N does have a $20 copay when you go to the doctors or to the specialists. But Plan G is higher in premium. Plan N is the most competitive. Here's the thing. The Medicare supplements on the individual markets are secondary to Medicare. They're designed that way, much like the Medicare supplemental plan offered by SCPEBA. One of the differences is the individual Medicare supplements, they do not include Part D drug coverage. So you would have to purchase a standalone Part D drug plan, also known to you as a pharmacy card, and those range anywhere from the $5.90 per month. If you have drugs that are preferred or tier 1 generic, then you would probably want to go with that one. If we find that we have your drug list, or you show me your drug list and I analyze the marketplace, there are plans that cover higher tier medications But I will say this: when I've done the research, most Part D drug plans in the individual market, the national average is $35 a month. But if you are someone that has high utilization, has needs a lot of health care, and you have medications that are higher tier, please, please, please just don't go with the individual market just because it's lower premium, lower rates. The group Medicare supplemental plan, Part D drug coverage under Express Scripts has a very vast and very vast and very good coverage for outpatient drug coverage, especially when it comes to higher tier medications. So I've researched that on formularylookup.com, which I have access to. And basically, if you have higher tier medications and have higher utilization, even though you might be paying a higher premium as partially funded or even fully funded, it is incumbent on you to know how much you're paying out of pocket for your Part D medications for your outpatient drug coverage. So just note that the formulary for Express Scripts within the Medicare supplemental plan is very good coverage and has very good coverage for higher tier medications, tier 1, tier 2, tier 2, tier 3, tier 4, giving you better coverage for those expensive medications. All right. So if you are someone that's very, healthy, doesn't have a whole lot of medical needs, doesn't need to go to to specialists and everything, it has very low utilization, then you can look into not only Medicare supplements, and you can look that up in Medicare New Handbook or online or what have you, but you can also look into the alternative option uh, from original Medicare. So what I mean by that is that you can look into Medicare Advantage in the individual marketplace. So when we're talking about Medicare supplements and the supplemental plan from Blue Cross Blue Shield, we're talking about secondary to original Medicare. When we're talking about Medicare Advantage, we're talking about a completely different beast, which is the optional alternative, which is a network-based health plan, much like much like the state plan, which is a network of doctors and hospitals. So it's going to be it could be Blue Cross Blue Shield, it could be AARP, which is the dominating force in Medicare Advantage in the individual market. But those are HMOs, PPOs, MSAs, and those are entirely different beast and conversation when you're looking into something that's very, very low premium, but has prior authorization as a factor when you're getting when you're having more and more use of your health plan under a Medicare Advantage HMO, PPO. But just note that all that marketing does not make you to where you are the beneficiary that is just looking at their health from a cost perspective. You should look at your health, obviously your budget, and then compare and analyze the Medicare supplemental plan as a secondary payer because it's group, it has good Part D drug coverage. Compare the Medigap plans within the state, Medigap plan letter G and plan letter N, along with the Part D standalone drug coverage for the individual market. So those two things go together. But if you want to have the lowest premiums and say you want to have the lowest out-of-pocket cost, then the individual Medicare Advantage plans, also known as Medicare Health Plans, that is the lowest premiums per month you can go, which means most HMOs, most PPOs that are Medicare Advantage are typically very low to zero premiums per month, other than the Part B premium that you have to pay to the federal government every month, which is the $164.90. So I know I said a lot there, but just note that when you are non-funded, you are paying the highest rate. When you're partially funded, you're paying a little bit above market value compared to the individual market. And then when you're fully funded, you are fairly competitive with the individual market for Medicare. So I hope this video has helped you. Please let me know if you have questions. I know it can be very daunting when you have all this solicitation coming to you, but I've literally been helping Medicare beneficiaries since 2016 over the phone. Please don't hesitate to get your hassle-free information from me, Mike at MedicareSavings.us. Take care and God bless.